In 1965, Dr. Robert Cade and his team invented a drink that would revolutionize athletic performance.
Naturally, we called our stuff Gatorade.
More than quench a thirst, it gave the Gators strength to push past their limits, leading them to a series of sweeping victories.
They've done it! They've done it!
Today, Gatorade fuels more than just athletes. Here at the University of Florida, where Gatorade was born, it's fueling research that's changing lives. The same innovative spirit and passion that defines Dr. Cade and his team's legacy is still alive today, 50 years later. The stories that follow are only a small glimpse into how Gatorade and UF are impacting the future, and this is only the beginning. You know how Gatorade changed the game. Now see how we are changing the world.
My research really covers a broad spectrum of things, both inside and outside of medicine, ranging from bench projects looking at neurodevelopmental effects of drugs, all the way up to a way to help keep football players cooler. So the really simple idea is let's blow air under the football pads, and let's make it dry air that we blow under the football pads so that accelerates the evaporation. So when I went to Bob Cade and we talked about the idea of blowing cool, dry air under their uniforms, under their equipment, he thought that might be a good idea, or that might work. And I thought to myself, well, if Bob Cade thinks that might work, then we might be onto something. We even got a grant from the National Football League to help study this. And I think what Bob Cade did for the university made everybody else realize somebody working quietly on something that was interesting and relevant to them could make a difference. And I think it's one of the reasons that our Office of Technology and Licensing is both the size and the caliber that it is because you got a whole bunch of people who say, I can do that too. I try to infect other people sort of with the idea that you can move the ball, to use a sports analogy, and that everybody can make a difference. And we really ought to leave this world a little bit different than we found it. And if you're working in a university, you have fresh young minds coming through. You have an opportunity to infect them with the notion, you know, I can do that too.
So the focus of my research is trying to understand the way that our brain works within kind of the constraints of our body, so our musculoskeletal system, and how it does that to control the way we walk and the way we control our balance. There's about 1.5 million Americans with Parkinson's disease, over 10 million people with essential tremor. The way we say it is if you live long enough, because of the natural decline in dopamine production with aging, that we're all going to have the symptoms of a movement disorder. We're able to provide a significant longevity to their lives. You know, we want our patients to experience life, right? You get a diagnosis of a disease, and that can be very devastating, but your life doesn't end. And so everything we do is designed to try to, again, empower them to participate, to make their life easier so that they can still contribute all the wonderful things that they contribute to society in spite of the fact that they have a disorder. We are a preeminent place. My colleagues expect me to publish in the best journals, to get the most grant money, to make the biggest impact on the world. And we're lucky because we have a lot of the resources to do that here at the University of Florida. Having the ability to have resources funneled back to the research mission or to the philanthropy mission, whatever it be, from companies like Gatorade, it provides so much through our laboratories and it provides us an advantage, right? We can recruit the best researchers, we can recruit the best doctors because we have the support from companies that other universities don't have and other research centers don't have.
Well, I study the early development and learning of young children, particularly young children who are most vulnerable. A lot of our work is focused on ensuring that as barriers to looking at people who have disabilities or challenges in life, as our society has changed in its ideas about inclusion and acceptance, that we want that to begin at birth and continue through a lifetime. I think one of the things that is important is to think about how you stand on the shoulder of a giant like Robert Cade and others. You can see further as an innovator. For me, it's innovation around how we think from an interdisciplinary perspective about optimizing early childhood development and children's earliest experiences. Child development is a dynamic process, and it occurs in the context of environments that either support or hinder optimal development and learning. The importance of the work that we do is to prevent unnecessary issues and spending later on in life and really ensure that we get all children off to the best possible start during those first 2,000 days. And we know from decades of research that children who are most vulnerable and their families benefit most when they're part of a community. So I think the power of what we're doing here at the University of Florida is really being able to reach into communities and partner with families and communities to help bring those science-informed solutions to communities that are most in need.
The main focus of my research is on tuberculosis and public health. Tuberculosis is one of the top 3 most important infectious diseases in the world when you look at it in terms of how many people get sick with it and unfortunately how many people die from it. Let me just remind you that TB has been completely curable and preventable. Those 1.5 million to 2 million people a year that die from TB are dying from a disease for which we have a cure. Epidemiology, which is the study of how diseases are transmitted from one person to another and how they move through different populations, is allowing us to better understand how TB is transmitted in Haiti and how, more importantly, drug-resistant tuberculosis develops in a group of people. And so our focus is to look at how TB is transmitted, how do you best train people there in providing service to people that desperately need it, and find ways in which we can apply what we've learned to improve the situation for those people and then use that as a model for around the world. Universities matter. They're not just places to get a degree, and that's important in and of itself, but research matters. So learning about our world, figuring out new ways to do things, finding evidence to make things better matters. And obviously the people that we serve matter the most. So tying all those things together and really finding the true purpose of what universities were built for, which is to allow us to find new discoveries, apply them to make people's lives better. That's what we're here for. To be a great university, we have to be a global university, and Gatorade is helping us get there.
Revolutionaries like Dr. Cade and his team members have left a legacy that lights our way forward. They show us the best of who we can be and lift the limits of our imaginations. They convince us that change is possible, that progress is inevitable, and that fading into the shadows isn't an option. Passion is an unquenchable thirst. Where will yours take us next?